Well, it's time for a health report, and joining us now is Africa 54 health correspondent Linord Moudou with an update on breast cancer drugs. Linord?
Researchers from the University of Pennsylvania say a drug used to fight breast cancer may be effective against other forms of the disease. Writing in the journal JAMA Oncology, the researchers say the drug palbociclib could attack other types of cancer cells while inflicting little or no harm to healthy cells. Palbociclib is an inhibitor which targets certain enzymes that drive rapid tumor cell division. It was the first such drug approved against breast cancer. A new study by the U.S. Centers for Disease Control and Prevention concludes that a combination of at least 6 drugs may be needed to combat the growing health menace of multi-drug resistant tuberculosis, MDR-TB. Currently, the World Health Organization recommends that 5 drugs be administered simultaneously. But the study, conducted at 26 sites in 9 countries, found that using 6 drugs could provide a necessary boost in efforts to defeat MDR-TB. Among the 1,100 adult patients in the study with MDR-TB, those who received 6 potentially effective drugs saw a 36% greater likelihood of responding to treatment compared with those who received 5 or fewer drugs. The findings were published in the journal PLOS Medicine. Now, blaming a poor economy, some citizens in Cameroon are now turning to the streets for cheaper medication. André Yapi has been selling medicine on the streets for over 2 years now. Street vendors such as André can be found on nearly every corner of Cameroon's many cities and towns. They are mostly unemployed youth and graduates.
In Cameroon, we entered a world of self-help because we did not find anything better elsewhere. From time to time, the police come and seize the drugs.
While there are no precise figures on the quantity of illegal drugs entering Cameroon, up to 70% of drugs sold are traded on the black market. Those involved in the trade are convinced that they are offering a very important service to the population.
Our motivation is that we are here to help. Putting medicine on the market is a very delicate point. Populations in Cameroon lack means. You see, costs in Cameroon today have become too high. For example, let's take a medicine sold for 14,000 CFA francs at the chemists. You'll find it here on our stalls at 7,000 francs.
The World Health Organization defines counterfeit medicine as one which is deliberately and fraudulently mislabeled with respect to identity and/or source. The International Policy Network, a British think tank, estimates that worldwide 700,000 deaths a year are caused by fake malaria and tuberculosis drugs. Oblivious to the dangers, customers continue to patronize the street vendors.
I buy my medicine in the streets because when you go to a chemist, it is very expensive. It's a huge expense in the chemist shop. Thus, when you go there and you cannot find the medicine which has been prescribed to you by the chemist, those street doctors, as we call them, will propose another drug to you at a lesser cost, at a low price.
Dr. Darlene Onogo warns against this worrying trend.
It is not really advisable to take medicine sold in the streets, what people call poteau, because the sellers of those medicine are not qualified to sell drugs. In some cases, you have to be a doctor or a chemist to know that such or such a drug is not suitable.
The government of Cameroon is fighting what observers call a near-losing battle. Vendors and suppliers of the medicine work in syndicates and are not ready to give up this illegal trade, which puts the lives of many at risk. That's our Africa Health Report for today. Vincent?
Well, Linord, thanks a lot. And be sure to watch Linord Moudou's health updates every Tuesday and Thursday right here on Africa 54.